Total Joint Program at Southwest is an integrated program that begins when a patient comes to visit his orthopedist or her orthopedist and lasts all the way through the final visits after the total joint replacement's been done. And that includes such things as preoperative teaching, all the things that go on in the operating room, all the things that go on in the hospital as an inpatient, and then the post-op physical therapy and management.
Nice and slow.
The idea being that we have a place for patients to come and get all their needs met, and that really facilitates a smooth journey through a joint replacement.
The journey begins with your diagnosis.
So this lady is in her late 50s, and she struggled for several years with this really knock-knee leg. So she has bad arthritis, she has no joint cushion between her bones.
There are three major things that I look for when thinking about a total joint replacement. One is a decrease in activities of daily living. Patients that can't get up out of a chair, patients that can't have difficulty getting out of bed in the morning. Patients that have a lot of pain at night. Arthritis does affect patients' joints at night, and patients that can't get to sleep or can't stay asleep or their joints wake them up. And finally, a decrease in walking tolerance. Patients that tell us they could walk a mile a year ago but can only get to the corner now. Those are three big factors for me.
Welcome, this is your orientation class.
The warm-up phase of the journey helps prepare you for surgery. You'll attend a joint journey class and take care of any medical tests that are required. You'll also be encouraged to pick someone to help coach you during recovery.
Well, I'm going to resist you a little bit. Good.
During your pre-op appointments, your surgeon can address any concerns you may have about your surgery.
I tell them that this is something that I do routinely, and I see people get good results repeatedly.
On the big day, you'll check in several hours before your procedure. Joint replacements are performed in the Furstenberg Patient Tower.
The operating rooms at the Furstenberg Tower here at Southwest are state-of-the-art. You know, our infection rate is only a fraction of what it is across the country.
Ready? Ready. Okay, go ahead and push yourself right on up.
You'll most likely spend between 2 to 4 days in the hospital and actually take a few steps within hours of your surgery.
Get your whole foot flat there. There you go.
While you're in the hospital, your physical therapist will teach you how to do your post-operative exercises. It's important that you continue these at home.
One more.
You really need to have consistency in order to get good results with joint replacement, and making sure that all the T's are crossed and I's are dotted produces good results.
Gently put it down.
Our goal is to have you go directly home from the hospital, so it's essential that you have your house prepared for your arrival. If you need extra care, there are several skilled nursing facilities in the area that can assist you. You'll be prescribed an anticoagulant medication to help prevent blood clots during recovery. The most common is warfarin. It's important to follow your prescription very carefully.
Straight knee and step.
Your outpatient physical therapy will last from several weeks to several months depending on your progress and the type of joint replacement that you had.
Right heel, tighten, step through.
Hips, I tell most patients that they're going to really be moving around quite well at 3 months. The knees are a little bit slower, and so I tell them that they need to continue doing their physical therapy for sometimes as long as 6 months. But typically by 6 months, most knees and hips are very pleased with the outcomes and are moving well.
Margaret Adams is moving extremely well. A year ago, she was nearly disabled by severe arthritis.
I could barely walk at any distance at all. I was bone on bone with both hips. My lifestyle had really come to a stop because I'm a fairly active person.
Margaret's joint journey has included 2 successful hip replacements at Southwest.
I feel like I'm a bionic woman because I'm able to walk with pain-free, golf pain-free. It's just amazing. I'm a totally new person.
What I would tell patients that are thinking about joint replacement but haven't made the commitment to come and see somebody is that today these are very safe procedures. Our outcomes are great, and the vast majority of patients that have a total joint replacement tell me, I wish I had it done sooner.
Margaret would definitely agree with that.
I myself put it off way too long because if I'd have done it a year before, I think I would just have been a better candidate for healing.
To learn more about Southwest Joint Journey, call 360-514-6787 or log on to swjointjourney.org.